Hello everyone, we are here live at City Hall with Megan Avallone, Director of the Westfield Regional Health Department. Today we're going to talk about COVID boosters and current guidance from the Health Department. Megan, since we haven't spoken to you in a while, would you please give us a summary of recent COVID-19 cases and what we're seeing in our area?
Good morning, Amy. Sure. So the good news is for many weeks, Union County has been showing low activity of COVID, which is wonderful. This is exactly where we want to be. But just this week, New Jersey as a whole started to show a rate of transmission above 1. So I know it's been a while, but if we remember, the rate of transmission of 1 is really the benchmark. If it's under 1, the people that are getting sick are getting smaller. If it's above 1, the people that are getting sick are actually getting larger. Just even though rates are low, we're not quite out of the woods yet. And with fall coming, we always see an increase in respiratory illness through the fall and winter.
Great. So how sick are people getting with COVID-19? I've heard that it feels more like a cold for healthy people.
Yeah, it's really an interesting thing. One of the things that we've seen consistently with COVID from the very start is there's really no rhyme or reason to who gets really sick and who might just have the sniffles. One of the great things is in this area in particular, immunization rates are really, really high. So that really does protect against severe illness. But I can tell you personally, my whole family came down with COVID a few weeks ago. We're all completely vaccinated and boosted. Everybody else just had a sore throat maybe for a day. I was stuck in bed for 3 days, completely up to date with vaccinations. Again, no rhyme or reason. But it's really important to remember that if you do come down with COVID and you do just have, a runny nose, the person that maybe you might unknowingly infect might end up really sick, especially if they're immunocompromised.
Got it. So when and where do you recommend wearing a mask? Should I be wearing one indoors right now, or who should be?
Yeah. So like I said before, Union County is now in what we call a low transmission, right? Low COVID activity. So that means the general risk at this time is pretty low. I think with masking, where we are now, is it's really a personal decision, right? Some people who are more at risk, who are immunocompromised or who are more at risk for severe illness, they may want to wear a mask indoors in crowded places moving forward, right? And I think that's completely acceptable, completely reasonable. For those of us who are not at high risk, we probably want to pay attention to those COVID levels, to those respiratory infectious levels that the state posts weekly. Low risk, the green map, if you will, that means you're not really at high risk for developing symptoms. Probably okay, completely fine to go maskless if you're low risk. Moderate, you might want to weigh your personal factors. But anytime you move into high risk, that red color, that's when I think it's really smart, especially if we're in crowded places that we do want to mask up. And remember, right, the masks aren't just for COVID. They're for all respiratory illnesses, and we're entering flu season as well. So, I've had flu once in my life, and I certainly don't want it again. So I think, masking during the winter in crowded places, if you're high risk, I think might make sense.
Recently, I've been masking when I have family events like weddings because I don't want to miss them. So I wear my mask up until it's time to go, and because it seems like when you do test positive for COVID, you need to spend time quarantining at home. Is that still the case?
It is the case. So if somebody tests positive for COVID, the isolation period was recently shortened. So now what we are saying is individuals who test positive for COVID should stay at home for 5 days. Day 1, the clock starts actually the day after symptoms start, or in the absence of symptoms, the day after the positive test. On day 5, if you feel better, what you can do is you can return to your activities on day 6 wearing a mask. Ideally, you're going to test negative on day 5. If you still test positive on day 5 and you don't have to leave your house, it's probably a good idea to stay home. But day 6 through 10, even if you test negative and are symptom free, you should really be wearing a mask outside the home.
Okay, good. Thank you. That's good to know. We've heard that there's another booster shot available. Can you tell us about who should get it, what ages they should be, and if there's updated guidance being given about it?
Yeah, so there is a really exciting news. There is a new booster shot available. This is called the bivalent booster. So it's different than the first round of boosters that we saw. What bivalent means is there's two concentrations combined into one shot. So what we have is we have the original vaccination concentration that we saw the first round of immunizations, and we have a second, which is really specific against the BA.5 variant. What's really great is this booster is going to be really effective against the COVID that we are seeing circulating in New Jersey. Like I said, it contains protection against the BA.5 variant, and in the last 6 weeks, the BA.5 variant has accounted for over 85% of the COVID cases that we've tested in New Jersey. So it's going to offer good protection about that. In order to be eligible for these new booster shots, you need to have completed your primary series. So that's either 2 shots of Pfizer or Moderna, or 1 shot of J&J, and you need to be older than 12. For the individuals, for the kids under 12, there are no new booster shots yet, so they're sticking with the first available shots.
Mm-hmm. So it gets a little complicated sometimes when you're thinking about all these boosters. So I've had 2 shots and 2 boosters. Should I get the third one, or are 2 boosters enough?
Yeah, it's really, really complicated. And later on, what we can do is I can post some graphics. I can share some graphics with the city to help residents really navigate it.
Thank
but
you.
Essentially, what we are saying is anybody who's eligible for a booster is anybody who's over the age of 12, has completed a primary series, and it's been 2 months since your last COVID vaccination. So regardless of how many boosters you've had, as long as you've completed the primary series and it's been more than 2 months since your last COVID immunization, you're eligible for the new boosters.
Okay, great. So which booster is best? Do you need to stay in the same family of shots that you've been taking? My colleagues had all Moderna shots. Should she continue with Moderna?
This is such a great question. So there's really no right or wrong answer here. Some people really like to stay with the brand that they've been with the whole time for the previous part of the series. Some individuals and some doctors think that there might be some benefit in mixing it up, right? In going with the other brand. But here's what I can tell you. The shots protect really, really well, equally well. It doesn't matter what brand you have. But what we always say is the booster shot you should get is the one that's available when you're interested in going. The availability of the booster shots may change down the road, and depending on several factors. So if it's convenient for you to go to make an appointment, and wherever you are they only have one brand available to you that day, my recommendation is go with the one that they have, because they're essentially interchangeable at this time.
Okay. So if people aren't dying from COVID anymore, do you really recommend that we get a booster?
People are still dying. We're still seeing several thousands of deaths a day in the country. But I understand when people say just what they mean. We're certainly not seeing the overwhelming deaths that we were early on. But think of it like this, right? I think that, it's a matter of 2 things. Your personal risk, right? The individuals that are around you, your friends and family, what their risk is too. Because as we talked about, you may not get sick, but maybe grandma, who you visit with frequently, might get really, really sick if she's inadvertently exposed. And then the other thing is too, as we mentioned, when I personally had COVID a few weeks ago, certainly I wasn't sick to be hospitalized. I was in bed for 3 days. For me personally, if I can do something to avoid that, I would want to. The other thing too is during the last wave, while we certainly weren't seeing an increase in deaths like we were previously, our local emergency rooms saw a really high influx of people presenting there. And while the individuals maybe weren't necessarily sick enough to be hospitalized, they were still sick enough to be presenting to the ED, treated and released. So, I think these are all things to consider when deciding whether a booster shot is appropriate for you.
Got it. So you just mentioned, Megan, that you had COVID recently. When will you get your booster? Will you need to get one since you just had COVID? How will that work?
Yeah, so what I'm going to do is I'm going to wait 90 days. There are some studies that show that waiting 90 days is really best. That's going to make the shots work best for my immune system. So on my 90-day mark, I have it marked on my calendar, I'm going to go and I'm going to get boosted as well. While I may have some immunity from my previous infection, we don't know how long that lasts. And certainly with COVID, doing all these investigations, we've seen many individuals test positive 2 and sometimes even 3 times, right? So I want to do everything I can to make sure that I don't get COVID again.
Mm-hmm. Great. So what about testing? I had a runny nose earlier in the week and feel fine now. Like when should you test if you feel like you have a cold?
Yeah, this is such a great question, and this is something that's kind of complicated to work through also. So what we typically say is anytime you have a known exposure and you come down with symptoms, you should consider testing, right? Anytime you have, if you're able to test and you just have a runny nose, I think that's great. Certainly, we really encourage testing if you have 2 or more symptoms, runny nose and a sore throat, a fever and a runny nose, body aches, and a sore throat. Or certainly any new cough, we really like residents to test, and any loss of taste and smell. We think it's a good idea to test them as well. But like I said, it is kind of complicated to figure out when you should test. So we always advise that if there's any question, individuals should reach out to their primary care provider for more direction.
So are home tests accurate?
They are, in the sense that if you get a positive home test result, it's not a negative, it's not a false positive, right? But where they're a little not so sensitive is that if you feel like you have COVID symptoms and you take a test and you test negative, what we always recommend is that you test again in 24 to 48 hours, because we know sometimes it takes a while for those viral particles to increase enough to be picked up on the at-home test.
Got it. Speaking of home tests, can a home test be administered for everyone?
That's a great question. So home tests are actually not approved for individuals who are under the age of 2. So if you have a child under the age of 2 that you think is symptomatic or that you think has recently been exposed, you should contact your pediatrician for more testing instructions.
Great. So the federal government recently ended the free at-home testing program through the post office. So where can people go to purchase an in-home test or get a test done in person?
Yeah, there are several ways locally. So the first way is the state of New Jersey is still running their vault program, so you can go online and through the New Jersey hub, COVID hub, we can post that information online.
I'll share that.
Yeah, it gets mailed directly to your house, and then you mail it back. Overlook is still doing their testing in their employee lot, I guess, but you do need an appointment for that. You can book an appointment online through the Atlantic website, and we will drop off some at-home test kits at Town Hall and the Community Center, and we'll send out a flyer. We'll post that later today, information on residents where they can get that as well.
Okay, that's great. So we'll have some free home tests that
Yes.
we'll be able to give out at City Hall and at the Community Center. Terrific, thank you. That's all the questions that I have so far, and I don't have any questions from everyone watching. But is there anything else that you would like to share or tell
Always
us?
have something else to share. We're talking a lot about COVID, and I feel like we're all so COVID fatigued, myself certainly. But one thing I just want residents to remember, everything that we're talking about prevention-wise with COVID applies to every respiratory illness. So we're entering flu season as well. The Southern Hemisphere had a really, really brutal flu season this year. And sometimes, or more likely than not, usually what happens is that we follow the same path. So, even though we're talking about COVID, we certainly don't want to see a lot of people come down with flu because flu can be really, really serious as well. So just a reminder to residents that, Wash your hands frequently. If you're high risk, consider masking in public places this winter. Get a flu shot. And if you're sick or if you feel lousy, please stay home.
Mm. And wear a mask if you have a cold.
Exactly, yes. If you have to go out, and as we're talking about personal choices, right? Even though the masking mandate is no longer required, it's no longer a mandate, there's absolutely nothing wrong if you choose to wear a mask to either, protect others or protect yourself.
Okay, great. And will you be sharing information on flu clinics with us?
Yes, thank you for reminding me. So we actually do have a scheduled COVID vaccination clinic, not flu, but a COVID vaccination clinic in Summit coming up. The flyer will be pushed out later today, October 7th at Jefferson School from 4 to 6 p.m. So that will be a completely free way for individuals to get their booster doses right here in town.
Okay, great. And then going forward, we'll share flu clinic information.
Yes.
Yes. All right. Well, thank you, Megan. This was wonderful. You gave us a lot of great information, and we'll continue to share it.
Thanks. Have a great day.